Metatarsalgia is a condition that describes pretty much any pain in the front of the foot. Scientifically, it's not actually a diagnosis as such because it can be broken into a lot of different conditions. These conditions can be around the big toe joint, around the middle of the foot, or even in between the small metatarsal bones. The common conditions that we get with metatarsalgia would be Morton's neuroma, a plantar plate tear, even bunions can be thrown into this broad group of conditions. First, in order to treat metatarsalgia, we need to work out what are the mechanics behind the reason that we're overloading these structures. And usually it's a combination of foot instability that's creating some overload in different parts of the feet. Typically we would use orthotics. These help by redistributing force around the more correct structures. For example, a lot of the time the foot rolls off to the outside edge and this loads up the small bones and can create a Morton's neuroma. We try and redirect the force back over the great toe, which will offload this area and hence people can walk pain-free. When we're treating conditions of the forefoot and metatarsalgia, orthotics need to be very specific. There's not really any off-the-shelf type devices that will work, purely because if they are too wide or too bulky, they can actually make the condition worse. If the position of a metatarsal support is within 1 to 2, 3 millimeters in the wrong spot, again, this can actually aggravate the condition. Orthotics aren't the only tool we use to address metatarsalgia or the associated conditions. Foot strengthening is a crucial part of this because when we wear footwear for extended period of times, these small muscles switch off and become lazy, so to speak. So by strengthening and stretching these muscles, we can achieve a lot as far as pain reduction. Often fashion footwear can be contributing to your foot pain and metatarsalgia. By addressing some of the shoes around this, you can really help alleviate your symptoms. Often this means that we're not going to get you to get out of your high heels, but if we can get you to wear more sensible shoes for your walking and potentially to and from work, this will go a long way. We get frequent referrals from GPs regarding this condition, and it's always a good idea to get a conservative view before heading down the surgical pathway. It is important to address your pain in your forefoot early. We know a lot of these conditions can lead on to severe deformity with retracted toes or even a very thickened nerve. And sometimes the only treatment for this would be surgical. As with most conditions in the foot, we try to avoid surgery as the recovery period is very long and can create other complications. So if you think you're suffering from metatarsalgia, then it's worthwhile making an appointment in one of our clinics to get it treated as soon as possible, as we don't want this to go on to further complications. We have multiple locations throughout Sydney. You can make a call and make a booking for a time that's convenient with you.